Hi, my name's Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the CU Public Health District, and she also happens to have a birthday today. Julie, hi, and thanks for joining me.
Hi, thank you.
Since we last talked, we have a new president-elect, and Joe Biden has said that he will put together a task force to fight coronavirus first thing. Let's say that he has your ear. What is your advice for the president-elect?
He's already doing what has got to make every single public health and healthcare person out there happy. He is assembling an absolute dream team of people. The people he already has put on it are the people that we listen to and we follow all the time. So it's pretty exciting. And in fact, there's even a Illinois connection. Dr. Julie Marita from Chicago, who I've worked with on various things for years, is on it. So it is going to be absolutely amazing. And just the fact that they'll be paying attention to it. I look for regular communication with the public because that is critical, and regular communication with public health professionals all over the country. So it's important that we get to a place where this virus is not seen as a political situation, because it is not. Unfortunately, I was all excited. I heard that after the election, the virus was going to go away, and unfortunately, it has not. It's still continuing to go on, and it's going to get much, much worse. It's not a joke. It's not political. The simple measures to prevent it are not political, and I'm concerned about where we're headed, honestly.
Let's start with some good news then. Before we get to the numbers in the area, drug company Pfizer has come out today with a late study that says that 90% of people are now vaccinated, and it was successful in their study. Can you explain this a little bit more?
Yeah, what happens when they have any type of vaccine candidate, vaccine that they're looking at, is it once it gets so far along, it needs to go into human trials. And part of a human trial for this involves something called a double-blind placebo study. So what they do is they take randomly selected people, and they give half of them the vaccination, the candidate vaccine, half of them don't get anything but a placebo. It means it's double blind because the people giving the vaccinations don't even know which one they're giving. So then they follow them for, I don't know exactly how long. They follow them along, and they're just going about their lives as usual, trying to prevent the virus in the ways that they normally do. And then at a certain point, they look and they see how many people have been infected. Then they do something called unmasking the data, where they look at the data to see of the people who were infected, were they vaccinated or were they placebo? And that I think that the initial results from this study are way better than anyone had hoped for. 90% is that would be an amazing accomplishment. And it is they still have to do the safety, the safety trials with it, but it's looking really good, and it is such hopeful news. And it is a new type of vaccine, so it's not like the flu vaccine. So, but there are already places in the U.S. trying it. I believe that this is out of Germany where they're doing it, and it's very exciting, because if we can get a vaccine and it shows to be safe and effective both, then they can start mass producing it as fast as they can in different locations, and we can hopefully it's still quite a ways off. I don't want people to get excited and think that this is going to prevent us from having a really, really rough winter around here, because it is not. But it is very, very hopeful news.
Even Pfizer was surprised, right? Wasn't Pfizer surprised that they were aiming for 50% efficacy, but suddenly
50% would have made people very happy. But what 90% means is, basically if you get exposed to the virus, you have a 90% chance of not getting infected with it. That's really good news. Really good news.
All right, then I don't mean to dovetail that with bad news, but I know that our community, our numbers are not looking great. Can you update us on those, please?
Sure. Not only are our numbers not looking good, the United States of America's numbers are not looking good. They're horrible. Illinois is looking awful. A lot of states are really dangerous. Where we're at right now, as of today, we've had Right, we have 420 active cases of COVID. 6 people from Champaign County are hospitalized with COVID. We've now had 34 deaths, and you know that that's gone up quite a bit in the last week. We have 1,382 people in quarantine. And what's really concerning, our regional positivity rate is up to 10.8%, and our Champaign County positivity rate is 7.5%. That is way too high for the amount of testing we do around here. So we know where it's happening. It's happening in places where people are going and they're hanging out without masks, whether that's like a bar that's sneaking around and getting away with it, whether it's, it is people gathering for birthday parties. It's the same stuff that we've been seeing. And I do want to stress with people, because I think this is really important. Just because you've been, let's say you're an older person, if you've been seeing your kids and grandkids all along and you haven't gotten it, that doesn't mean that you're not going to get it. So anybody that you have contact with, you are going to risk infection. So anybody that you have indoor contact with, unmasked and within 6 feet, we're seeing a lot of it, and we're seeing a lot of older people get infected, and we know how they're getting infected too. So you infect the ones closest to you.
Also, since we last talked, J.B. Pritzker, the governor of Illinois, has closed indoor dining, and he has mandated that bars are closed as well. Have we seen that has helped the numbers, or it's too soon to tell?
Well, a lot of places don't seem to be doing it. I mean, we get stuff all the time from places. Some places are doing the amazing job, especially in Champaign-Urbana. They're doing the amazing job that they've been doing all along. And then we have other places who are just ignoring it. A lot of counties just are not even bothering to do it. And they're continuing to see outbreaks. We're seeing pretty much the same outbreaks that we've been seeing. Like I said, bars and places like that think they're getting away with something by having these events that we're not getting to shut down. They're not getting away with anything. What they're doing is getting people infected, and it's leading to some negative outcomes.
You mentioned the national number a minute ago. I've got a stat for you. The country recorded 100,762 new cases and 450 new deaths as of last night, marking the 5th highest day of new cases in the country since the pandemic began. Are we even in the peak of that, or are we seeing that climb right now?
We're not even close. We're on a straight up exponential growth curve, and it's concerning. I mean, I don't know. I just keep getting on here and every time saying more and more and more. But I've really been saying the same thing since the beginning. So it's going to take individuals. It's going to take individuals doing what they need to do. And we're to the point now where we're going to be in for a rough winter, and we're going to be in for a long time of people they're really going to need to stay home, whether it's mandated or not. If you don't have to be out and about, don't be out and about. So sorry about that.
It's, I understand you are possibly the most in-demand person in the county right now, so no worries on the phone.
A lot of phone buzzing and text and things going on right now.
My question for you about the exponential growth. It took 100 days at the beginning to get to 1 million cases. It's taken 8 days to add 1 million lately. What do you attribute to that exponential growth so quickly?
That's how it works. I mean, that's how exponential growth works, is that, and I think people don't get that. And we try to say it as much as we can, but what has happened previously is not what's going to happen. It's not what's happening now, and it's not what's getting ready to happen. This virus is going wild out there, and it's going wild for one reason, and that's because people are allowing it to. And as much as I, am happy that people are out celebrating and things in the street when something happens, or protesting when something doesn't happen, those are spreader events, super spreader events. Again, they don't care what the politics are. They don't care. They care that the virus cares that if you don't have a mask on, and it can go from person to person if you're too close. That's all it cares about.
There's a new study out, and I thought this was already decided, and you've said this, that it now shows that a cough can now spread further than 6 feet with droplets. Mm-hmm. So if you're asymptomatic and you go just to a small family gathering and you cough, then it's pretty much guaranteed you're going to be patient zero, correct?
Yep, that's pretty much correct. Yes. That's exactly what we're seeing. People don't realize they're sick. They're going to meet with grandma and grandpa, or have the kids over, or whatever. They're doing things that they have been doing all along, just because they're related, or they're really good friends or whatever, and they think that they're safe. But that's not what's happening. And then before you know it, everyone's infected, and then they've taken it back to their jobs, and they've taken it back to their schools, and it just keeps going and going. And we're seeing that.
I see people determined to get together for Thanksgiving, and they have plans. They are going to get tested. Everyone in their family is going to get tested every 3 days leading up to Thanksgiving. Is that effective?
Only if they're absolute. I don't know where they came up with it, getting tested every 3 days, but so the thing is, you can be, I suppose if you're in quarantine, you could quarantine everyone for 14 days. And I mean, everyone that's going to be in that place. And by quarantine, I mean, you're not around anyone else. That's not going to school. That's not, going to work. That's unless you can absolutely stay away from people. Quarantine for 14 days, then get together. That will be safe, assuming that no one has developed symptoms. Then you test before you do it. The amount of work that is involved in that is going to be, overwhelming, basically, for people to do that and to do it right. And I think what's happening is people are talking themselves into kind of the whole magical thinking thing that we've been trying to get people not to do, and think that you can come up with some way to get to do what you want to do safely. And it takes a lot of work. And the fact is, anytime you gather with anyone, you're risking your health and you're risking their health, because we don't know. I have had so many people who have just, gotten infected, and the next thing you know, they've infected their whole entire family and extended family.
The testing obviously is the key, and you've been praising this community on testing. The U of I know you can make appointments at one of Walgreens in town to get a time and date of testing. But with this amount of testing, it's taking a little longer through the mall. So what is your advice to people that want to get tested and want to do something, but there's a waiting period?
Well, that's the thing. Testing is important. It's important for public health. But if you're just testing and then going back doing what you're normally doing, and not testing and isolating and waiting for the results, what you're doing basically is causing potential spread if your result comes back positive. So we do have a lot of testing. We are working with the state, trying to get our local labs to be used rather than the labs that are farther away. That should help get our testing times back down. But, there was an article about our contact tracing program this weekend in the newspaper. And, we're expanding and expanding and expanding. But just like with everything, there are limitations on, what can be done. So people really have to be responsible for themselves, and their families. That's the key. That's going to be the key to going forward. We can just keep saying the same things over and over, and I can guarantee people that I will keep us as staffed up as possible around here. But that's not going to prevent our healthcare system from becoming overwhelmed. Again, just because the hospitals can expand out a lot and put in a lot more beds and put in a lot more, whatever they might need, there's still staffing issues. You always are going to have a finite number of resources, no matter what.
Last question before I let you go. Now that we have a clinical trial moving in the right direction, now that we have a president-elect who has appointed actual infectious disease experts to a task force, do you have a glimmer of hope, or are you still in the weeds with the numbers right now?
Well, I always have hope, although I'm much, much more hopeful today with the news of Pfizer. The thing with the new coronavirus task force, unfortunately, that's not going to even be able to start doing things until middle of January. And it's right now the beginning of November. We're going to have a very rough November, December, and January. And there's no getting around it unless people change their behaviors. There's not going to be any getting around it.
Name one thing you're going to do today to celebrate your birthday that is not COVID related.
Well, I went out to lunch today, so and I sat outside and it was beautiful out. So I have already done that. So that was great.
Good. Well, this community celebrates you. Happy and healthy birthday. Thank you to Urbana Mayor Diane Marlin. We picked up some food Saturday night, trying to keep the Urbana economy going, as well as our producer, Jason Liggett. Thank you for UPTV and all that you do for us. But Julie Pryde, administrator of the Champaign-Urbana Public Health District, you and your staff, I don't even know how to thank you. So thank you so much for your time.